Welcome to our part 3 video on the topic of inflammation. So again, to summarize for those that are watching this as their first video, so we looked at the definition of inflammation. We also discussed the two types, which is acute and chronic. So now in this video, we are going to proceed and look at the list of the topic, which is the process of inflammation. Now, how does inflammation occur? Then we are going to also look at the clinical features or the cardinal signs of inflammation. Then to summarize, we are going to also look at how now acute inflammation ends. So these three parts, we are going to talk about them in this video. So be sure to watch my part 1 and part 2 video for acute and chronic inflammation, so that you'll be able to understand well this process of inflammation and those 5 cardinal signs I mentioned to you. So again, at the end of the video, I will show you a simple way on how you can remember the processes of inflammation. So be sure to stick around to the end of the video, so that you will come and know a trick on how you can understand the topic in 10 minutes. So be sure to stick around so that you do not miss out the trick. Right, so to begin our topic for today, we are saying that we are looking at the processes of inflammation. How does inflammation occur? So, what process of inflammation? So, what is the process, or how does your body respond to an injury? If you fall, you cut yourself when you're chopping the vegetable. So regardless of the injured agent, the mechanism of inflammation is basically the same. So the mechanism, so here you need to know now the mechanism of inflammation. So we said that it is basically the same for all injuries, whether you have a burn, whether you have a cut, whether you have a wound, and whether you have an infection. So all those causes, basically the mechanism is the same. So you just need to know this mechanism. So now, what is this mechanism? So the mechanism of inflammation is divided into 2 divisions. So we have the first one, which is vascular response. Then we also have cellular response. So what do we mean when we say we have 2 processes which are involved in inflammation? So we know that inflammation, this is the defense mechanism. So you have to understand that whenever we're talking about defense, what should come into your mind are the blood vessels. So the first thing you need to know is the blood vessels. So those blood vessels are known as vascular organ. Then, so if we say vascular response, we are saying that this is how your blood vessels will respond to inflammation. So vascular response involves the blood vessels. Then, when we talk about what? Cellular response. So cellular response, this is now how the cells inside the blood vessels will what? Respond to injury. Because we say that the white blood cells are the ones which are responsible for eliminating the what? The pathogens. And the white blood cells, basically the neutrophils. So now to begin our mechanism, we are going to break down it. So we'll start by first looking at what? The vascular response. So what are some of the vascular response? So imagine we have a blood vessel. So this is a blood vessel, and here we have what? Skin. Yeah, so imagine you cut yourself here. So when you cut yourself here, of course this is what? An injured. So what happens to this blood vessel down here? So this is a blood vessel. So immediately you cut yourself, the blood vessel will undergo what is known as transient vasodilation. So immediately you cut yourself, the blood vessel will become what? Vasodilated. So imagine this is your skin, then here you have cut yourself, you have a cut. So your blood vessel will undergo what is known as vasodilatation. So vasodilatation is basically the expansion of the blood vessel just at the area where the injury was. So now what causes your blood vessel to expand? So immediately you cut yourself, there are some chemical mediators which are released. So these chemical mediators, they are released by your endothelial cell. So once your endothelial cells are injured, they release some chemicals which causes the blood vessel to dilate. So those chemicals are what? So you need to know these chemicals. So one important chemical which is released under the vascular response is what? Histamine. So histamine is one of the chemicals which is released. Then we also have other chemical mediators. So other chemical mediators, we have serotonin, we also have leukotriene and prostaglandin. So these are some of the chemical mediators which you need to know when you are talking about the vascular response, how the blood vessels respond to injury. So we say that once you injure yourself, the arteries in the area will undergo what? Vasodilatation, which is transient. Then after that, this vasodilatation is caused by the release of what? Histamine and other chemicals such as serotonin, leukotriene, prostaglandin. So they can ask you in your MCQ, which of the following are what? Chemical mediators in inflammation. So you need to know that you have histamine, serotonin, leukotriene, and prostaglandin, which causes the vessels to dilate. So now, how can you write this as a point. Of course, I was just explaining. So in case the question comes, I'll post the PDF where you check for the what? For the notes. So we said that after the injury, so you can write after injury. So we say after injury, your body will release what? Histamine and other chemical mediators. Then this will cause what? Your arteries to vasodilate. Yeah. So this is basically the first process which occurs under what? Vascular response. So now what happens when the cell have done what? They have vasodilated, they have expanded. What happens next? So after the blood vessel or the artery has expanded, this will allow a condition which is known as hyperemia or redness, one of our cardinal signs. So what is hyperemia? So we said that after the vessels have expanded, it will result in increase in permeability. Leading to what? Hyperemia or redness. So hyperemia, this is just a condition where there is increase blood flow to the area. So here, when we're talking about hyperemia, or the reason those people who are light skinned, after they get bitten by a mosquito, their skin first turn red. So this is how. So once the mosquito bites you, the skin or the blood vessel will release what? Histamine. Then histamine will cause the blood vessel to vasodilate. Then a lot of blood will start to accumulate to this area, causing the area to start looking red. So that's the first cardinal sign we talked about in inflammation. So this is how it comes about. So another thing which you need to know is what? Now, how does that swelling comes about? Because we are saying that the process of inflammation, there is also one cardinal sign which is swelling. So now, how does that sign comes about? So this same what? Vasodilatation and the chemical mediators will do what? They will cause those cells which I talked about, the endothelial cells, to retract. So this is a blood vessel, and we know that all blood vessels are lined by cells which are known as endothelial cells. So once histamine and the blood vessel becomes vasodilated, this endothelial cell will do what? They will retract. So once they retract, they will start leaving what? Spaces in between the what? The blood vessel. So once these spaces have been made, it will now allow the movement of fluid from the blood vessel outside. So this is now how white blood cells will come and escape the blood vessels, because the white blood cells need to move outside so that they can what? They can attack the what? The pathogen. Yeah.